If you or a loved one has been diagnosed with early-stage uveal melanoma, it's important to know your options because timing of your care is critical. Your doctor may have discussed with you the option of prognostic molecular tumor testing to get a better understanding of your individual risk of the cancer spreading or metastasizing to other organs. This video will tell you the basics about uveal melanoma and how molecular tumor testing can help you and your healthcare team make more informed decisions about your medical management. Let's start with cancer staging. Doctors evaluate their patients to understand how much cancer is within the body and if it has spread, and then assign a stage. The staging system goes from stage 1 to stage 4. Stage 1 is the least severe, where the cancer is small and localized to one area. Stage 4 is the most severe, meaning the cancer has spread outside the eye to other organs in the body. This spreading is called metastasis. Traditional tumor staging can be used to estimate a patient's prognosis by examining the tumor for physical clues that the cancer might be aggressive. In uveal melanoma, this staging is typically done by careful clinical examination, where your doctor will take measurements of the tumor using non-invasive tools like a slit lamp, direct or indirect ophthalmoscopy, or ultrasound. Most newly diagnosed uveal melanomas are classified as stage 2 and are considered to have generally good prognosis. But some of these early-stage melanomas will spread or metastasize anyway. In fact, according to the American Joint Committee on Cancer, up to 20% of stage 2 tumors will metastasize within 5 years. These staging estimates represent the outcomes of large groups of patients whose tumors share similar characteristics. Today, however, technological advances allow scientists to look inside a person's cancer cells for new information about their risk based on their unique tumor biology. There is now a prognostic test called DecisionDx-UM that identifies which tumors are at high or low risk of spreading within 5 years, based on a patient's individual molecular tumor profile, or tumor class. This type of testing can be performed on a small biopsy sample taken by your doctor to examine your particular cancer on a molecular level. Rather than relying on information gleaned from being grouped by stage, you can now have information specific to you and your cancer. For example, a patient who is told they have stage 2 cancer and a group risk of 20% might be worried. But with results from Castle's specific molecular test, they could learn that their risk for metastasis is actually much lower. Conversely, a patient diagnosed initially as stage 1 with a group risk of 3% might think they may not have as much to worry about. However, with the Castle test, they could find out their individual risk for metastasis is actually higher. Though not the results they were hoping for. With this added level of individualized information, the patient and doctor can develop a more personalized management plan that includes the frequency of checkups and additional treatment that is required according to your class result. If you are worried that your test results might be too much information, know that 99% of surveyed patients reported gaining value from their test result, including increased knowledge and understanding, information relevant to life planning, more personalized care, and relief from uncertainty about the future. In addition to DecisionDx-UM, there are 2 tests that can also be performed from the original biopsy sample. Further information obtained from these additional tests, along with your class result, provide your doctor with a comprehensive genomic profile of your individual tumor and may help to further refine your risk for developing metastatic disease, as well as provide information necessary to participate in some clinical trials. In this difficult time, it's important to know your options and to talk to your doctor about whether the Castle uveal melanoma tests are right for you. To help guide the conversation, download the Talk to Your Doctor guide at myuvealmelanoma.com or call Castle Biosciences at 866-788-9007 to learn more.